According to the Southern Nevada Health District, over the past 2 weeks, we've seen a significant rise in COVID-19 cases, hospitalizations, and deaths. And our local transmission rate has risen above 13% for the first time since spiking over the summer.
13 Action News anchor Ross DiMattei shows us what our local hospitals are doing differently now to prepare for a potential second wave of the virus.
As I reflect back to mid-March, I think we were all kind of scrambling to address the virus and how to prepare.
While reflecting on the first wave of coronavirus cases here in the Las Vegas Valley, these hospital executives paint a grim picture.
When we first got our COVID patients, all the hospitals were, I think, in some respect, unprepared for what we were going to see.
Admitting no one was prepared for this pandemic.
I think it was something that was new for all of us to experience, but I think we all learned a lot during that process in terms of what to prepare for and what to have in place.
Starting with stockpiling PPE.
China had perhaps the entire world market on PPE. When they shut down their factories and didn't have the distribution got impacted, it made it very difficult for hospitals across the world.
Early on, it was very difficult to get masks and gloves and gowns. You know, we've learned not to rely on one or two vendors. We've been able to source products throughout the country and the world.
Expanded and instant testing technology has helped hospital staff identify and isolate COVID-positive patients to stop it from spreading.
We are finding a lot of the population that are COVID positive and just didn't know it. About a third of our patients that are in the hospital that are COVID, we were able to identify through our testing. They weren't there because of respiratory illness. They were there for something else.
And for patients suffering from severe symptoms, doctors are relying less on ventilators and more on the prone position paired with FDA-approved therapeutics.
Hydroxychloroquine, remdesivir, Regeneron is on its way, which is a 2 monoclonal antibodies that really stops the virus and protects those cells that are not infected. So we see the early intervention with remdesivir really slows down the symptoms. So I think that's what is helping the hospitalization rate and also the death rate ultimately.
Meanwhile, multi-million-dollar expansion projects like this brand new bed tower at Centennial Hills Hospital are increasing patient capacity by adding about 80 beds.
Whether it's the flu, whether it's COVID, we feel even more prepared from a facility perspective to service the community.
And just in case our hospitals do get overwhelmed, health officials have put a plan in place to turn the Las Vegas Convention Center into an alternate hospital, adding about 900 beds if necessary.
As the positivity rate grows, we know that translates to more hospitalizations, and we want to avoid that.
Whatever the second wave will look like here in Las Vegas, our hospitals say they will be ready. But in the end, only the public has the power to keep COVID-19 under control.
Social distancing, mask wearing, avoiding large crowds, avoiding, big holiday get-togethers with your family. As much as we all want to do this, there'll be another time to do it where we can do it safely. If we relax on those and disregard those, we may find ourselves in positions like some of these other states are seeing.
In Las Vegas, Ross DiMattei, 13 Action News.